Hello everyone, welcome to CripChat, your weekly podcast on everything disability. I'm your host, Jonathan, and tonight we have Alexandra. Hello, how are you?
Hello, thank you for having me.
So before we do get started, can I tell me about you?
So, I am an autistic woman and I am a director of People with Disability Australia, or PWDA.
Let's get into it. So this week was the thing the federal budget and the implications for Australians with disabilities. So, how does the federal budget address the needs of Australians with disability?
Well, in short, it doesn't really address the needs of Australians with disabilities. There are so many missed opportunities in this budget, but I will say that there is significant funding allocated for something called general supports. And general supports actually refer to foundational supports. So within the NDIS review recently, a key part of that reform is about understanding how the service system hasn't quite worked out in the 10 years since the NDIS has rolled out, and working out how the service system can be improved for people who can't access the scheme. So that's what foundational supports refers to. So the budget talks about general supports, and they are actually part of that foundational support model, which has general supports and targeted supports. So the general supports are for the foundation of a good life, and that's providing services like access to information, support for carers and families, additional things that people with disability might need. And so I think that allocation is a significant affirmation that the government is saying, yes, we've heard what the review has said and we are going forward with this important piece of work.
What changes, if any, have been made to NDIS funding in this budget?
The budget does say that the government will continue to improve the NDIS, and certainly the reform is going full steam ahead because we've seen a lot of changes already. And the budget includes a package of measures totaling 175 million over 4 years, and then another allocation of funding per year to ensure that the NDIS continues. I think it's important to understand that although the NDIS review is really pointing to experience for people with disability and how that can be improved, really the reform for government is about making it smaller. It's been growing exponentially, and there's a target to reduce that growth. And they've already achieved that in a really, really short time, down from 22% to a 10% growth rate. And they've achieved that by looking at the two things that make it balloon, and that's the number of people that come into the scheme, so how people are assessed to be in the scheme, and then what supports that they actually have. And we've seen some reform in the legislation which talks about lists of things that people can have and things that they can't have, and that's how we've gotten really tight. So although the scheme is certainly going ahead and we won't lose the NDIS, we're certainly seeing a slimmed down NDIS. At the same time, the NDIS is a massive part of the DSS budget. It's about 90%. So that's certainly to me a big commitment that we are definitely not losing that scheme.
Thank you for your answer. So how does the government plan to ensure the sustainability of the NDIS while meeting growing demand for
Great.
services?
Definitely in the ways that I just spoke about in terms of looking at who's coming into the scheme and what they can get out of it. But another really core way of ensuring the sustainability of the scheme is actually foundational supports, which we know we've got funding for. So foundational supports actually ensures that people aren't pushed into the NDIS because there's nothing else for them to go to. So we've seen that very much with children with disability, and there was more children with disability than anyone could have estimated, and that was because the services, mainstream services, were not meeting the needs, early intervention needs for children with developmental delays or disability. And so foundational supports will provide that layer of support, which means people aren't driven into the scheme, and then it becomes more sustainable in the long term.
Thank you for the answer. Beyond the NDIS, what provisions are there for health care services that cater for people with disabilities?
There's nothing specifically for healthcare services for people with disability. However, we might indirectly be impacted by changes to the Medicare system, and there's certainly definitely an expansion of funding for the Medicare system, which has been struggling for quite a while. So one example of something that could impact neurodivergent people, for example, is potentially expanding the role of Medicare items for psychology. So when psychology came into the Medicare scheme, it came in with a bang, and it's been growing exponentially, and people with disability and psychosocial disabilities have certainly benefited from mental health care plans. However, because of that huge unchecked growth, the number of sessions that we're able to access has been reduced, and so potentially the reform within the Medicare system can impact us in things like access to mental health care plans.
Thank you. Does the budget include initiatives aimed at increasing employment opportunities for people with disabilities?
Again, unfortunately, the budget doesn't give anything specific for employment opportunities for people with disabilities. However, back to foundational supports, what they'll actually do is under general supports is improve the way that we provide support through the Disability Employment Service, and there'll be work to ensure that there's a joint action plan to help that service work with other employment services to improve employment outcomes for people with disability.
Are there any incentives for employers to hire individuals with disability or programs to support entrepreneurship within the disability community?
I don't think there's specific incentives for employers to hire individuals with disabilities, but certainly if foundational supports through those general supports, which we've got funded, improve the services for disability employment, that support is definitely in there. And there's other service providers who work really hard at providing those kind of services to support people with disability in workplace and employment settings. So certainly expanding that under general supports will help with that.
Thank you for the answer. What investments have been made in education training programs that are inclusive of students with disabilities?
There isn't anything targeted for education and training programs, which is really, really disappointing because we know that this was a big focus of the Disability Royal Commission, which is quite absent in this budget. And certainly we'd want to see more of that support for inclusive education. But one thing we do see, again, back to foundational supports, there's actually a part of those supports which are called targeted supports. And I just want to say that that wasn't specifically flagged in this budget. They only talked about general supports. Potentially these will be layered on later. But if we are talking about targeted supports, there's certainly some for life transitions. So what this does is recognise that young people with disability often struggle with those big life transitions, particularly between high school and then transitioning out into further education, TAFE, or higher education. So the development of supports and initiatives to help these young people transition will certainly be something that is on the horizon, although we can't be certain because this has been defined by the NDIS as something that's targeted, not general, and we're only seeing general in the budget at this stage.
Are there any budget measures aimed at enhancing social inclusion and community participation for people with disabilities?
Not specifically, but if you dig into it, you can see that again in general supports, there is provision for an improvement in peer support and self-advocacy initiatives. So peer support, what that does is it actually creates local groups which provide peer support, mentorship, and the ability to develop community. And that is certainly something that's very much a focus of the National Autism Strategy and building on self-advocacy initiatives. So we know that the self-advocacy movement came out of the independent living movement, and it's definitely something that supports people with disability and empowers them to be able to advocate for themselves across a range of settings. So whether that's about being included in the community or whether that's about being included in their workplace. The other big one, though, is actually money for a project called Accessible Australia, which is actually going to look at improving infrastructure, accessible infrastructure for national parks, beaches, and play spaces. So this is significant because it will allow more people to get out into the community and enjoy the good aspects of life and not just have to be focused on budgets that focus on employment and education. Although really important, there's that recognition that human rights also include the ability to be able to have recreation and enjoy ourselves. So what this does is allows more people to go into these spaces with their families and experience these things. So some of the things that could be provided would be all-terrain wheelchairs in national parks, improving walking paths, and looking at accessible equipment at beaches, including beach chairs and roll-out mats.
Thank you. Sounds awesome. How has the disability community been involved in the budget planning process?
I'd say that indirectly we've been very much involved. So people with disability are able to participate in these big government processes through their disability people's organisations or DPOs like PWDA. And the government actually funds the disability advocacy program so that organisations like PWDA can talk to government and participate in advisory groups and make submissions and convey the views of people with disability to government. So I would say that when something like this is prepared, that certainly government is aware of how the key issues for our community. But the budget really is a reflection of what's in front of the government, like what is their key area of focus. And it's about what they've chosen to focus on, not what we've communicated to them.
Thank you. Are there any mechanisms in place to ensure that the voices of people with disabilities are heard in policy making decisions?
Well, certainly, if foundational supports, which we know is being supported by government, does manage to improve self-advocacy programs, that is certainly one way that people can be empowered to advocate for their well-being and their needs. The other thing that is important is obviously the role of disabled people's organisations, but what we try to do is make sure that we're representing the people with disability. So we run a lot of events where we talk to people with disability and understand the reactions to key policy issues, and our submissions to government are very much structured around what our members have said about key issues. You can join advisory groups, which are high level, or you can join community groups, and you can join peer support networks and self-advocacy groups. And the disability advocacy space is actually a small space, and eventually we all end up talking to each other. So we're very clear about what we're all thinking. So we all have different opinions and different perspectives. But we all do work together to achieve the same goals.
How does this year's budget compare to previous years in terms of support for the disability sector?
I feel like we're seeing a reduction in mention of people with disability, which is really disappointing. I feel like hopes were very high in the last few years with the Disability Royal Commission and the NDIS review. It was certainly our time to have our key issues in the spotlight, and I don't think that's been really translated into this budget. And as I said before, budgets are about how governments allocate resources, and it shows what is a key area of focus and what isn't. And disability is not considered across a range of issues. And although foundational supports is a win, it is certainly a big achievement. The fact that the Disability Royal Commission wasn't mentioned is certainly a big oversight, and I feel like this budget has certainly got a very reduced focus, and it's definitely not focused on disability.
Are there trends indicating increased or decreased prioritization of disability issues by government?
I'd say that on the one hand, the government's very focused on the NDIS, and there's been a lot of energy in changing legislation, consulting with disability people's organisations, co-designing key aspects of the reform, which is good. But the other side of it is that the Disability Royal Commission recommendations, which one would consider are much broader and include more people with disability potentially, impacting a range of sectors from the justice system and including marginalised groups like Aboriginal and Torres Strait Islander people with disability. So because that review was responded to by government in 2024, but the response was quite lacklustre. So of the recommendations, only 8% were accepted, and those that were accepted, you could argue, were quite easy to implement, so updating resources, things like that. And they were very much in line with the government's view and focus. But then the things that really matter to the community, like the ending of segregated settings in education, employment and housing, and that really great governance system which would have improved accountability from the government, those things were accepted for further consideration or not accepted at all. So the new governance structure was actually put for consideration because the government's looking at a Human Rights Act instead of a Disability Act. And what that does is focus on everyone from a diversity perspective. So we are considered with other diverse groups. But, you know, one could argue that the Australian Human Rights Commission, over 40% of their complaints relate to disability. And I definitely think that there's a need for a more disability mainstreamed focus. All the opportunities were there and the structure was presented. However, the government has not committed to those core things in a way that we really wanted them to. I mean, one notable exception is their commitment to review the DDA, which has been around for a really long time, since the 90s. And there's certainly things in there that need to be improved. So that's a win. But I think that the poor response from the Disability Royal Commission for sure is a clear sign that disability is not a key area of focus, and we're not getting the response that really we'd hoped.
What are disability advocacy organizations saying about the 2025 federal budget?
I think we're all saying the same thing. We're saying that it is very much a missed opportunity and that disability is largely missing from the budget. You know, there are 5.5 million Australians with disability, and one would argue we are the most human of experiences. Disability comes to us all and at some point, and it should really be something that's on the forefront of everyone's mind. And the fact that it isn't is really, really disappointing, and that we are entitled to support. It's not something that's optional for us, it's something that is required.
Are there particular areas that they feel the budget falls short or exceeds expectations?
Obviously, the commitment to foundational supports is a really big one, and I don't think we should underestimate what an important step this is, because for a long time, if you can't access the NDIS, then you don't necessarily get the supports you need in mainstream services, and foundational supports is that layer that's been missing and will impact the lives of people who can't access the scheme for the better. But there are some things that really fall short and are not even mentioned. So one is the cost of living crisis, particularly for people with disability. So we know that people with disability and households, in fact, with a person with disability are more likely to live under the line of lower income. The spending that they need to have, particularly for medical issues and technology, can also mean that we've got greater expenditure than other households. So the cost of living crisis is really impacting people with disability, and there's no targeted initiatives to rectify that situation. The other is housing initiatives. So in policy, we're hearing a lot about affordable housing, and yes, that's really important for people with disability, and that, because we do live often at a lower income level, we're more at risk of homelessness. But affordable housing also needs to include accessible housing, and we haven't seen anything about that. Why that's really important is because when service areas aren't connected, and which they're often not, because we don't have foundational supports in place. So if someone with complex support needs is in hospital and they don't have access to NDIS services, or even if they do, and there's no accessible accommodation available, then a lot of people end up in aged care. And as of 2015, over 7,000 young people with disability were in aged care because of the service system was not coordinating, and that the government had not put adequate funding into accessible housing and accommodation and supported accommodation. The other one is I wanted to mention is also about gender and family violence. So there's initiatives for women's safety and to address family violence, but people with disability, women with disability, gender diverse groups are more likely to experience family violence. And there is a specific type of violence called disability-based violence, where caregivers can withhold medication or care. So that's really important that the new initiatives for about family violence do include people with disability. And finally, look, we've had a hurricane, so emergency management's on the agenda. We know that people with disability are really vulnerable in disasters and have a higher rate of actually not making it out of those situations. So again, while there's a lot of focus on disaster preparedness and relief, there's really not anything that's acknowledging the specific needs of people with disability in this budget.
What steps should the government take moving forward to address any gaps in this budget concerning disability support?
I feel like it's really just about, the first step is to understand the issues. And although we do a lot of talking as advocates, I don't know necessarily if we're reaching the right forums or the right people to hear the key issues, unless the government's interested in those issues. So I guess the first step would be to for the government to acknowledge that the experiences and outcomes for people with disability are disproportionately harder, and that key targeted initiatives need to be in place to fix those outcomes, and that the work of advocates and the knowledge and expertise of the lived experience of our community needs to be put at the forefront and to be really included in a range of programs. So we've talked about a few programs around emergency management and family-based violence. It's really just about making sure that when we do those initiatives that we're putting that lens over it as well, and looking at it from an intersectional perspective, but also specifically from the perspective of people with disability.
how can individuals and advocacy groups engage with policymakers to influence future budgetary decisions?
I think the first thing is that if you're interested in advocacy and you want to make a difference, there's lots of ways that you can ensure that your views are heard and that you can influence future budgetary decisions. One of the simple things you can do is join an advocacy organisation like PWDA, because we do offer quite a few opportunities for members to hear the issues, because I think that information is power in this space. It's very hard to advocate when you can't understand all the key issues. And look, these policies are really inaccessible for everyone, I think. And I spend a lot of time translating these documents and these review recommendations and presenting them to grassroots advocates and to community groups. And this information is really empowering because it allows them to understand the key issues and to intersect with groups like PWDA or community-based groups or even peer groups to start to think about what our response will be and look for opportunities like taking part in consultations or submissions on key issues. The government will always have an engagement piece when something big is changing within the system. And I know that, for example, the NDIS reform is always looking for people with disability to join co-design groups and advisory groups. So there's lots of ways that people can be involved in the space.
Thank you so much for joining us. You've been watching CripChat, your weekly podcast on everyday disability. Join us next week for more CripChat.